What are the key components of a pre-anesthetic assessment and why is each important? Answer. Pre-anesthetic assessment ensures the patient is fit for anesthesia and minimizes complications. Key components include patient history. This involves reviewing the animal's medical history to identify any chronic conditions, e.g., diabetes, heart disease, that might increase anesthetic risk. It also includes checking for any allergies to anesthetic drugs. Physical examination. A thorough exam assesses cardiovascular, respiratory, and neurological systems. It helps detect issues like heart murmurs, lung abnormalities, or signs of dehydration that could influence anesthesia. Diagnostic tests. Blood tests like CBC and biochemistry panels provide insight into organ function and electrolyte balance. Electrolyte imbalances, especially potassium or calcium, could cause complications during anesthesia. ASA classification. The American Society of Anesthesiologists (ASA) physical status classification system helps assess anesthetic risk based on the animal's health condition. High ASA grades indicate increased risk, guiding the anesthetist in selecting appropriate anesthetic protocols. Explain how monitoring anesthetized patients differs from monitoring conscious patients. Answer. Monitoring anesthetized patients differs significantly from monitoring conscious patients because anesthetics depress physiological responses. Key differences include cardiovascular monitoring. In conscious animals, vital signs like heart rate and blood pressure are typically stable. Under anesthesia, the heart rate can decrease and blood pressure often drops, requiring continuous monitoring via ECG and blood pressure cuffs. Respiratory monitoring. Conscious patients breathe normally, but under anesthesia, respiratory rates can slow down, leading to hypoventilation. Capnography and pulse oximetry help monitor end-tidal CO and oxygen saturation, respectively, ensuring effective ventilation. Temperature regulation. Anesthesia impairs thermoregulation, making the animal more susceptible to hypothermia. Continuous temperature monitoring is vital to prevent this. Neurological status. Reflexes such as the palpable reflex become less responsive as anesthetic depth increases. Monitoring these reflexes allows the anesthetist to assess and adjust anesthetic levels, ensuring the animal remains at the appropriate depth. Regular monitoring of these parameters is crucial to detect any deviations from the normal range and to ensure patient safety throughout the procedure. Describe the pharmacological differences between local and general anesthetics and their indications. Answer. Local and general anesthetics differ in their mechanisms of action and clinical applications. Local anesthetics. These drugs block nerve transmission at the site of administration. Common examples are lidocaine and bupivacaine. Local anesthetics are ideal for procedures like dental work or minor wound suturing, where only a localized area needs to be numbed. They act rapidly and have a relatively short duration. Bupivacaine lasts longer than lidocaine. General anesthetics. These agents induce a state of unconsciousness by depressing the central nervous system (CNS). They can be inhaled, such as isoflurane, or injected, such as propofol. General anesthetics are used in more invasive procedures like major surgeries, where the animal needs to be fully unconscious and immobile. Local anesthetics are preferred for minimally invasive surgeries, while general anesthetics are necessary for extensive surgeries where deep sedation or unconsciousness is required. Both types of anesthetics can be used together, with local anesthesia providing post-operative pain relief and general anesthesia ensuring the animal remains unconscious during surgery. Mr. Lee's dog Max is undergoing surgery for a foreign body removal. During surgery, the monitor shows a sudden drop in blood pressure 50 Hg systolic and a heart rate increase to 150 bpm. What steps should the veterinary technician take? Answer. The sudden drop in blood pressure and increased heart rate suggest the animal is experiencing hypovolemic or anesthetic shock. Immediate actions are necessary. Assess anesthetic depth. Check if the anesthetic level is too deep. If so, reduce the inhalant anesthetic or administer a dose of reversal agents like atipamezole for dexmedetomidine. Administer fluids. Begin intravenous fluid therapy to counteract the low blood pressure. Crystalloids, e.g. lactated ringers, should be administered rapidly 102 /g over 15 minutes to restore circulating volume. Administer vasopressors. If fluid therapy alone doesn't raise blood pressure, drugs like dopamine or ephedrine should be used to constrict blood vessels and increase blood pressure. Monitor parameters. Continuous monitoring of heart rate, blood pressure, and blood gases is essential. If the blood pressure does not stabilize, consider further diagnostics to rule out other underlying issues. Effective management of this emergency is critical to ensure recovery and prevent organ damage. How is pain assessed in animals, and what are the limitations of common pain assessment tools? Answer. Pain assessment in animals relies on both objective and subjective indicators, behavioral signs. These include changes in posture, vocalization, and activity levels. For example, a dog in pain may whine or refuse to move. Physiological indicators, increased heart rate, respiratory rate, and blood pressure can signal pain. Monitoring these parameters helps gauge pain severity. Pain scales. Tools like the Glasgow Composite Pain Scale or Visual Analog Scale (VAS) combine clinical signs with observer ratings. These scales help categorize pain, but are subjective. Facial expression. In cats, changes in facial expression, e.g., squinted eyes, flattened ears, can indicate pain, a method particularly useful for feline patients. Limitations. Pain responses can vary between species, making standardized scales less accurate. Chronic pain may present with fewer overt signs, complicating assessment. Observer bias can influence subjective scales, especially in less experienced technicians. What are the principles of aseptic technique, and how do they prevent surgical site infections? ASIS. Answer. Aseptic technique prevents contamination and reduces the risk of ASIS. The core principles are hand hygiene. Thorough scrubbing with antiseptic solutions removes transient microorganisms that could infect the surgical site. Sterile field. All instruments, drapes, and surfaces within the surgical area must remain sterile. Non-sterile personnel should avoid touching sterile items. Patient preparation. This includes clipping and disinfecting the surgical site with antiseptics, e.g., chlorhexidine. The goal is to reduce skin flora and prevent contamination during surgery. Environment control. Surgical areas should be clean with proper ventilation, e.g., laminar flow to minimize airborne contaminants. Movement around the sterile field should be limited to reduce the chance of contact. Sterile technique is essential for preventing ASIS, which can lead to prolonged recovery and additional surgeries. How should a veterinary technician respond to surgical emergencies such as uncontrolled hemorrhage? Answer. In the case of uncontrolled hemorrhage, immediate intervention is crucial to prevent severe blood loss and shock. Control bleeding. Apply direct pressure to the wound with sterile gauze. If necessary, use hemostatic agents or place clamps to control vessel bleeding. Alert the surgeon. Notify the surgeon immediately to address the source of bleeding, such as ligating a ruptured vessel. Fluid therapy. Administer intravenous fluids, e.g., crystalloids or colloids, to maintain blood volume and prevent hypovolemic shock. This should be done rapidly, typically at EKG within the first 15 minutes. Monitor vital signs. Track blood pressure, heart rate, and hematocrit levels to assess the patient's response. If blood loss is significant, blood transfusions may be required. Quick action can save the patient's life and prevent complications. Describe the selection process for suturing materials based on wound type. Answer. The choice of suturing material depends on several factors. Absorbable versus non-absorbable. Absorbable sutures, e.g., polyglycolic acid, are ideal for internal sutures as they do not require removal. Non-absorbable sutures, e.g., nylon, are used for external wounds where the material must stay intact for longer periods. Monofilament versus multifilament. Monofilament sutures, e.g., polypropylene, are preferred in contaminated or infected wounds because they have less risk of harboring bacteria. Multifilament sutures, e.g., silk, are stronger and easier to handle but can increase infection risk. Tensile strength. The material should be strong enough to withstand tension but not so strong that it compromises tissue healing. For example, Vicryl is used in soft tissue closure because it provides appropriate tensile strength while being absorbable. The selection depends on wound location, the type of surgery, and the required healing time. What protocols should be followed when sterilizing surgical instruments? Answer. Proper sterilization ensures that instruments are free of microorganisms that could cause infections. Cleaning. Instruments should first be cleaned to remove organic matter. This is done using enzymatic cleaners or ultrasonic cleaning to break down debris. Sterilization methods. Autoclaving. The most common method involving high-pressure steam to kill microorganisms. It is effective for most surgical instruments. Gas sterilization. Ethylene oxide. Used for heat-sensitive materials. It involves exposing instruments to ethylene oxide gas. Cold sterilization. For materials that cannot withstand autoclaving. Chemical sterilants like glutaraldehyde are used for disinfection. Storage. Instruments should be stored in sterile, sealed packages to maintain sterility until use. Each step is essential to ensure instruments are sterile and safe for surgery. Discuss the role of the veterinary technician in post-operative care and patient recovery. Answer. Post-operative care is critical for ensuring a smooth recovery. Monitoring vital signs. The veterinary technician ensures that the animal's heart rate, respiratory rate, and temperature remain stable, and they monitor for signs of pain or distress. Pain management. Administer analgesics as prescribed to manage post-surgical pain. Techniques may include opioid medications or non-steroidal anti-inflammatory drugs, NSAIDs. Wound care. The technician ensures that surgical sites are clean and dry and checks for signs of infection, redness, swelling, discharge. Fluid therapy. If the animal is dehydrated or still under the effects of anesthesia, IV fluids are administered to support recovery and prevent shock. Owner education. The technician provides instructions to the owner about post-surgical care, such as wound management and signs of complications. By actively managing post-operative care, the technician ensures the animal recovers safely and quickly. A veterinary clinic receives 4 emergency patients at the same time: a dog with mild lacerations from a minor fight, a cat showing labored breathing and cyanosis, a puppy vomiting repeatedly with no diarrhea, a rabbit with a limp but no other signs of distress. Using the principles of triage, in what order should these patients be treated and why? Answer: triage is a critical process for prioritizing emergency care. The correct order is: first, the cat with labored breathing and cyanosis. Cyanosis suggests hypoxia, which is life-threatening. This requires immediate respiratory support and assessment for possible respiratory failure. Second, the puppy vomiting repeatedly. Vomiting can lead to dehydration or signify toxicity or obstruction, warranting quick intervention to prevent further complications. Third, the dog with mild lacerations. Lacerations are concerning but not immediately life-threatening. The dog requires cleaning, suturing, and possibly antibiotics, but it can wait for more urgent cases. Fourth, the rabbit with a limp. While painful, the limp is not immediately critical and the rabbit can be treated last. This triage follows the 8BC principle: airway, breathing, circulation, prioritizing life-threatening conditions first. Guidelines from the American College of Veterinary Emergency and Critical Care (ACVEC) emphasize immediate action for respiratory distress and shock before addressing less urgent cases. What are the 4 stages of periodontal disease in animals, and how do they differ in clinical signs and recommended treatments? Answer: periodontal disease is staged based on severity and clinical findings. Stage 1: gingivitis. Signs: redness, swelling, and mild irritation of the gums, but no attachment loss. Treatment: professional cleaning, scaling, and home dental care. Stage 2: early periodontitis. Signs: mild bone loss up to 25% and gingival recession. Treatment: scaling, root planing, and possible localized antibiotics. Stage 3: moderate periodontitis. Signs: moderate bone loss, 25-50%, increased gum recession, and mild tooth mobility. Treatment: deeper cleaning, potential extractions, and systemic antibiotics. Stage 4: advanced periodontitis. Signs: severe bone loss, over 50%, loose teeth, abscesses. Treatment: extractions, periodontal surgery, and possibly restorative treatments. This classification helps guide treatment. According to the American Veterinary Dental College (AVD), early stages can be reversed with intervention, but advanced stages may require surgery and extractions to prevent further complications. Preventative dental care is key. Sarah, a registered veterinary technician, is monitoring a cat recovering from surgery for pyometra. During her checks, she notices the following signs: pale mucous membranes, a capillary refill tie CRT of 4 seconds, and weak pulses. The cat's heart rate has increased to 200 BPM. Question: what should Sarah do next, and what condition might the cat be experiencing? Answer: Sarah should immediately notify the veterinarian and start supplemental oxygen therapy to address the potential for hypoxia. She should prepare emergency fluid therapy isotonic crystalloid fluids for intravenous administration, aiming to restore circulation. The prolonged CRT and weak pulses suggest poor perfusion, possibly indicating hypovolemic shock due to blood loss or inadequate fluid replacement post-surgery. The elevated heart rate is a compensatory response to decreased blood volume or oxygen delivery. Monitoring vital signs like lactate levels and blood pressure is critical to assess the severity of shock and guide treatment. In this scenario, the condition aligns with hypovolemic shock often seen in post-surgical patients, especially after pyometra surgery, where blood loss can be significant. According to the RECOVE, our initiative for veterinary resuscitation, swift action is necessary to prevent organ failure and stabilize the patient. What steps are involved in diagnosing an oral tumor in the dog, and why is a biopsy essential? Answer: the diagnostic process for oral tumors involves Clinical examination, a thorough inspection of the oral cavity to assess any abnormal growths or lesions. Imaging, radiographs, CT scans, or MRI help evaluate bone involvement or metastases. Biopsy, a tissue sample is collected from the tumor to determine its nature, benign versus a malignant. Histopathology is critical to assess the malignancy grade and possible metastases, which imaging alone cannot confirm. A biopsy is essential because it provides definitive information about the tumor type, guiding treatment decisions. Depending on the findings, treatments may include surgical excision, radiation therapy, or palliative care. Veterinary oncologists often recommend biopsy for any suspected malignant tumors, as early detection and intervention improve prognosis. The American College of Veterinary Surgeons (ACS) and Veterinary Cancer Society (VCS) emphasize biopsy as the gold standard for tumor diagnosis. What is antibiotic stewardship, and how should it be implemented in a veterinary clinic? Answer: antibiotic stewardship involves the careful selection, dosage, and duration of antibiotic therapy to reduce the development of resistance. In a veterinary clinic, this includes proper diagnosis, ensure antibiotics are only prescribed for bacterial infections, culture and sensitivity testing, perform testing to identify the specific pathogen and choose the most effective antibiotic. Appropriate dosage, administer the correct dosage based on the patient's size, condition, and infection severity. Duration of therapy, use the shortest effective duration of treatment to minimize resistance. This approach helps combat the growing issue of antibiotic resistance, ensuring long-term efficacy of available drugs in both animals and humans. A 4-year-old dog is presented with signs of shock, including rapid heart rate, weak pulse, cold extremities, and pale mucous membranes. What is the most appropriate initial treatment for this patient and why? Answer: volume and improved tissue perfusion. The type of fluid will depend on the suspected cause of the shock. Crystalloids, e.g., lactated Ringer's solution, are typically used to restore intravascular volume and are the first line in cases of hypovolemic or distributive shock. Colloids may be used if the shock is severe or if the patient has lost significant blood volume. The goal is to improve perfusion to vital organs and restore normal blood pressure. Monitoring should focus on blood pressure, heart rate, and oxygenation levels. The administration of oxygen therapy is crucial to support oxygen delivery to tissues. If the shock persists despite initial fluid therapy, further interventions may include vasoactive drugs, such as dopamine or dobutamine, to support heart function and improve blood pressure. Shock treatment is time-sensitive, as delay can lead to multi-organ failure. According to the American College of Veterinary Emergency and Critical Care (ACVEC) guidelines, aggressive fluid therapy and rapid stabilization are essential for survival. A dog presents with inflamed gums, bad breath, and difficulty eating. Radiographs show moderate bone loss around the teeth. What are the recommended treatment options for this dog, and what is the prognosis? Answer: the dog is likely in the early to moderate stages of periodontal disease. Treatment options include professional scaling and root planing. This is the first step in treating periodontal disease. It involves cleaning the teeth below the gum line and smoothing the tooth surfaces to promote healing and prevent further infection. Antibiotic therapy. In some cases, local or systemic antibiotics may be prescribed to address any bacterial infections in the gums. Possible extraction. If teeth are severely affected or mobile, extraction may be necessary to prevent further pain and infection. Home dental care. Regular tooth brushing, dental chews, or special diets can help manage and prevent further periodontal disease. The prognosis depends on the stage of the disease and the effectiveness of treatment. If treated early, dogs can make a full recovery and maintain their oral health. However, untreated periodontal disease can lead to more severe issues like tooth loss and systemic infections. What is the role of defibrillation in the resuscitation of a veterinary patient, and when is it indicated during advanced life support (ALS)? Answer: defibrillation is used during cardiac arrest when the heart exhibits ventricular fibrillation (VF) or pulseless ventricular tachycardia (VT). These arrhythmias prevent effective circulation, and defibrillation delivers a controlled electrical shock to the heart, allowing it to resume normal electrical activity. Defibrillation is indicated when a patient presents with these arrhythmias and shows no palpable pulse or respiratory effort. It is performed as part of the CPR cycle following the initial steps of ensuring airway patency, breathing support, and chest compressions. For veterinary patients, defibrillation is typically done using an automated external defibrillator or a manual defibrillator, depending on the available equipment. The shock should be administered after 2 minutes of effective chest compressions if the patient remains in arrest. According to the ICOV, our initiative, defibrillation is a critical part of ALS in veterinary medicine, but its success depends on prompt administration and proper CPR techniques. The earlier defibrillation is performed, the better the chance of a favorable outcome. Mr. Smith brings his 10-year-old Labrador Retriever Max into the clinic after being hit by a car. Max is conscious but shows signs of shock such as weak pulses, rapid heart rate, and pale gums. His left rear leg appears to be broken and there is visible blood loss. What immediate steps should Mr. Smith's veterinarian take to stabilize Max, and what potential complications should be considered? Answer: the first step in managing Max's trauma is shock management. Initial stabilization: administer oxygen therapy to support oxygenation and IV crystalloid fluids, e.g. lactated Ringer solution, to restore blood volume. This should be done quickly to address the signs of shock, control bleeding, apply pressure bandages to any open wounds to control blood loss, and monitor for signs of hypovolemic shock. Pain management: administer analgesics to manage pain and reduce stress, which could worsen the shock. Fracture management: stabilize the broken leg with a splint or bandage to prevent further damage during transport. Diagnostic testing: conduct radiographs and blood tests to assess the extent of the injuries. Potential complications include internal bleeding, organ damage, and further fracture complications. Monitoring for progressive shock is critical, as hypovolemic shock can lead to organ failure if not managed promptly. When treating a dog in septic shock, what role do antibiotics and fluid therapy play in the management of the condition? Answer: in septic shock, fluid therapy and antibiotics are both crucial to managing the condition. Fluid therapy: aggressive fluid resuscitation is the first step in treating septic shock to restore intravascular volume, improve tissue perfusion, and maintain blood pressure. Crystalloids, e.g. lactated Ringers, are typically used for initial resuscitation, followed by colloids in severe cases. Antibiotics: broad-spectrum antibiotics should be administered early after obtaining culture and sensitivity samples to identify the causative organism. The goal is to reduce the bacterial load, prevent the spread of infection, and control inflammation. Vasoactive drugs: in severe septic shock, drugs like dopamine or norepinephrine may be necessary to support blood pressure and improve perfusion. Septic shock causes a systemic inflammatory response leading to vascular leakage and poor perfusion. The use of fluids restores blood volume, while antibiotics address the underlying infection. According to the Surviving Sepsis Campaign guidelines, early recognition and aggressive treatment within the first hour of shock onset are key to improving survival rates. What physiological indicators are used to evaluate the recovery of a post-surgical patient, and how can each parameter reveal complications? Answer: physiological indicators for post-surgical recovery monitoring include heart rate, atria. A persistent tachycardia may indicate pain, hypovolemia, or shock. Bradycardia could suggest excessive anesthetic depth or electrolyte imbalances. A respiratory rate or tachypnea might indicate pain, hypoxemia, or hypercapnia, while bradypnea may result from anesthetic depression or neuromuscular issues. Mucous membrane color and capillary refill time, CRT. Pale or cyanotic mucous membranes suggest hypoxia or perfusion deficits. A CRT longer than 2 seconds indicates circulatory compromise. Temperature: hypothermia can slow recovery, while hypothermia may indicate infection or reaction to anesthesia. Behavior and activity levels: restlessness, vocalization, or lethargy could indicate pain, while return to normal activity levels signals recovery progress. Monitoring must adhere to guidelines like the American Animal Hospital Association, AHA standards, ensuring protocols for detecting complications like shock or infection. Describe the critical considerations when administering a controlled substance to a hospitalized patient, including legal and ethical aspects. Answer: key considerations. Dosage accuracy: proper calculation based on patient weight and condition, avoiding under or overdosing. Documentation: record all administered doses, including date, time, and responsible technician per DE. Regulations for controlled substances. Storage: secure medications in locked cabinets compliant with DE and state veterinary boards. Patient monitoring: monitor for adverse reactions or signs of drug efficacy. Informed consent: obtain the owner's consent for use, explaining potential risks and benefits. Ethically, the veterinarian and technician must prioritize patient welfare while adhering to the principles of veterinary medical ethics, PVMA. What are the steps for proper wound debridement, and why is a septic technique critical during this procedure? Answer: steps for wound debridement: assess the wound, evaluate tissue viability using color, texture, and odor as indicators. Prepare the area, clip hair around the wound and disinfect surrounding skin. Remove necrotic tissue. Perform sharp or enzymatic debridement to excise non-viable tissue. Irrigation: flush the wound with sterile saline or an appropriate antiseptic to reduce bacterial load. Closure or dressing. Decide whether to close or leave open for secondary intention healing, applying sterile bandages. Aseptic technique importance. Using aseptic techniques prevent introducing pathogens, mitigating infection risks. Guidelines from the World Small Animal Veterinary Association WIVA recommend sterile instruments and gloves during debridement to ensure optimal outcomes. Explain the importance of sample collection timing and handling when performing a hematology test and how improper handling might affect the results. Answer: sample collection timing and handling are critical for accurate hematology results. Timing: blood samples should ideally be collected before administering any medications or fluids, as certain treatments, e.g., corticosteroids, can alter blood cell counts. Additionally, fasting or non-fasting states can affect parameters like blood glucose and triglycerides. Handling: anticoagulants. Use the appropriate anticoagulant, e.g., DTA3-BCS heparin for plasma analysis to prevent clotting and preserve cell integrity. Temperature: blood samples should be kept at room temperature unless specific guidelines suggest refrigeration, e.g., plasma for glucose testing to prevent cell degradation. Transport time: delays in processing can result in changes such as RBC lysis or platelet count, which will interfere with results. Improper handling can lead to erroneous results such as falsely elevated or reduced cell counts, which may influence diagnosis and treatment decisions. The Clinical Laboratory Standards Institute (CLSI) provides guidelines for proper collection, handling, and processing. During a routine surgical procedure, the patient's blood pressure drops below the normal range. What steps should the veterinary technician take to address this, and what could be the underlying causes? Answer: steps to address hypertension during surgery. Assess the anesthetic depth. A drop in blood pressure can result from excessive anesthetic depth. The technician should check the anesthetic machine settings, ensure proper ventilation, and adjust the anesthetic depth. Increase fluid administration. Hypovolemia is a common cause of hypotension. Administering IV fluids, e.g., crystalloids or colloids, can help restore blood volume and improve circulation. Monitor and adjust drugs. Consider the drugs used as some anesthetics, e.g., isoflurane, can cause vasodilation, contributing to hypotension. Reducing the dose or administering vasopressor agents like ephedrine can counteract the effect. Positioning: ensure the patient is positioned correctly to allow for optimal circulation. Other causes: hypotension may be caused by underlying conditions like dehydration, hemorrhage, or sepsis. The technician should work with the veterinarian to address any secondary issues. According to veterinary anesthesia and analgesia guidelines, blood pressure should be maintained at 80/10 mmHg for small animals under general anesthesia. Dr. Harris is performing a urinalysis on a 4-year-old domestic short-eye cat, Daisy, who is presenting with lethargy, vomiting, and weight loss. The urinalysis shows a specific gravity of 1.10, proteinuria, and a ECG of 7. What do these results suggest, and what would be the next steps in Daisy's diagnosis? Answer: the results suggest potential kidney dysfunction. Specific gravity (SG) of 1.10. This is low for a cat, indicating a possible inability of the kidneys to concentrate urine, which is often seen in renal disease. A normal SG for a healthy cat is 1.035, 1.60. Proteinuria. The presence of protein in the urine indicates renal compromise, as protein loss is commonly associated with glomerular or tubular damage. pH of 7. A neutral pH in the presence of proteinuria can support the suspicion of kidney disease, as acidic urine is often seen with certain types of kidney disorders. Next steps should include blood tests, perform a serum creatinine and BUN to evaluate renal function and determine if Daisy is in renal failure. Ultrasound or radiographs. Use imaging techniques to assess kidney size and structure for signs of disease or abnormalities. Urine culture to rule out infection, which could contribute to proteinuria. Explain the key quality control measures that must be in place to ensure accurate and reliable results in a veterinary laboratory. Answer: key quality control measures in a veterinary laboratory include calibration of equipment. All diagnostic equipment, e.g., analyzers, microscopes, must be regularly calibrated according to manufacturer specifications to ensure accuracy. For example, hematology analyzers require daily calibration using control materials. Standard operating procedures (SOPs). Laboratories must develop and follow SOPs for each test to ensure consistency in sample collection, processing, and analysis. This includes clear protocols for handling samples, reagents, and troubleshooting. Control samples. Run known control samples alongside patient samples to monitor for deviations in results. This helps identify any malfunctioning equipment or reagent issues. Preventive maintenance. Regular servicing and cleaning of diagnostic equipment are essential to prevent technical failures that could compromise results. Documentation. Detailed logs of testing procedures, calibration checks, and maintenance records are required for compliance with industry standards and accreditation bodies like AAHA or the College of American Pathologists (CAP). During a surgical procedure, the veterinary technician observes that the surgeon is using a non-sterile instrument on a sterile field. What immediate actions should the technician take to prevent contamination and maintain the sterile field? Answer: immediate actions. Alert the surgeon. Politely inform the surgeon of the breach in sterility, pointing out the non-sterile instrument that was used. Remove contaminated instrument. Immediately remove the non-sterile instrument from the sterile field and replace it with a sterile alternative. Check other instruments. Review the entire sterile field for other potential breaches, including non-sterile gloves, drapes, or instruments. Re-establish sterility. Ensure that the sterile field is re-established using sterile drapes and instruments. If the breach was significant, consider re-sterilizing the field or starting the procedure again. These actions follow the guidelines set forth by the Association of Veterinary Technicians in America (AFTA) on maintaining aseptic technique and ensuring the safety of both the patient and surgical team. Explain the principles of monitoring vital signs during a post-surgical recovery period in a dog. What parameters should be closely observed, and how should deviations from normal be addressed? Answer: monitoring vital signs during post-surgical recovery is crucial to detect any complications early and ensure patient safety. The key parameters to monitor include heart rate and rhythm. The normal heart rate for a dog is typically between 60 and 140 bpm, depending on size. Bradycardia or tachycardia could indicate anesthesia residual effects or underlying issues such as hemorrhage or hypoxia. Respiratory rate. A normal rate is 1030 breaths per minute. Hypoventilation or rapid breathing may suggest anesthetic complications, pain, or hypoxia. Temperature. Post-surgical hypothermia is common due to anesthesia effects. Core body temperature should be maintained around 101–102 below 99 warming measures like warm fluids or heating pads should be employed. Blood pressure. Low blood pressure could indicate inadequate fluid resuscitation or shock. Normal systolic pressure is around 110–160 or AHE in dogs. Hypotension may require fluid therapy or vasopressors. Pain assessment. Observe behavior for signs of pain such as restlessness, panting, or guarding. Administer analgesics as needed, following the veterinarian's guidance. Mrs. Green has brought in her 7-year-old cat, Felix, for a dental cleaning. After the procedure, she expresses concern about the cost and asks if dental cleanings are necessary for the cat. How should the veterinary technician respond to Mrs. Green's concerns? Answer: the technician should provide educational information, offering a balanced response. Explain the importance of dental health. Inform Mrs. Green that dental health is essential for overall well-being. In cats, untreated dental disease can lead to painful conditions such as gingivitis, tooth resorption, and systemic infections, particularly affecting the kidneys and heart. Discuss potential consequences of skipping dental care. Highlight that neglecting dental care could result in more severe and costly health problems down the line, such as abscesses, tooth loss, or systemic infections from oral bacteria. Offer options. Discuss the costs involved with the procedure and alternative options, such as at-home dental care, including brushing Felix's teeth or using dental chews. Reassure Mrs. Green. Acknowledge her concerns about cost and offer to discuss payment options or a treatment plan that fits her budget while ensuring Felix's health is maintained. By following these principles, the technician applies AAHA guidelines on patient care and client communication, providing clear, empathetic responses to the client's concerns.